Hey guys, it's Hina Sheth from Rebalance Physical Therapy and Wellness in Philadelphia, Pennsylvania, as well as on the main line in Narberth, Pennsylvania. And today I'm going to talk to you about whether you should think about taking that trip if you've hurt your low back all of a sudden. Now, the inspiration from this video comes from, a couple weeks ago, I actually hurt my low back coming from the vet appointment, putting a leash on my dog of all things. And the next day we were leaving for a trip to Hawaii, which was a 12-hour nonstop flight. And then it was going to be a pretty active vacation. So I thought, if I got to figure this out, I know that my patients and many of you guys out there probably may have to deal with the same situation. So I wanted to create this 3-part series of what you need to be doing and whether you should cancel that trip or not. Okay. So number one, the first thing you need to think about is you hurt your low back. Is your pain localized to your back, or is there pain actually going down into your leg? And I'm not saying like, I kind of feel it a little bit in my butt. I'm talking about, are you having pain that is going down your leg? Like sciatica, burning, nervy type pain that is going down your leg, okay? Couple of things you want to look for. If the pain is going down your leg, are you getting any numbness or tingling into your legs or into your feet due to that back injury? Or 3, are you having any weakness? And I'm not talking about weakness as in, oh yeah, I kind of feel weak and painful. I'm talking about weakness as in, do you feel like you're walking and your foot is dropping on the ground? Is it foot flopping, okay? Or do you feel like you can't push up off, when you're taking a walk, it feels like you're kind of limping, not because of pain, but it feels like you don't have the strength. Or do you feel like something in your leg is feeling like it's going to make you collapse, okay? That is weakness, and you got to kind of separate it from pain, because you can have pain and that kind of makes you feel a little weak, but you can have weakness that is like, oh no, my muscle isn't working, okay? So those are the 3 things. If you have any of those 3 things going on, you really do need to see a physician or talk to your physician and tell them what's going on. Most likely, when something like that is going on, it means that a nerve is involved. And when a nerve is involved, that's when you want to be more concerned, because you don't want that going on and being irritated for too long, because that can cause more long-term issues, okay? So if any of those 3 things are happening, pain down the leg, numbness or tingling, or weakness, okay, true weakness, you need to talk to your physician. Most likely, they're going to want to put you on some sort of steroid or medication to calm down the inflammation, and that's going to need to be prescription strength. So after talking to your physician, okay, or your PT, because there's a lot of people who will contact me when this has happened and I'll tell them what to do, all right? Once you talk to them, then they might be able to tell you, hey, take these NSAIDs and you're fine to go on your trip. Now, if you do not have either access to a physician, okay, well, let's put it this way. If these things are happening and you don't have access to a physician, but you need to go on this trip, you got to find out wherever you end up on this trip, can you have access to a physician? Because like I said, if this is nervy and all this is going on, you're probably going to need to be on something to kind of take care of the symptoms, okay? Now, if your pain is just localized to your low back, you might be able to kind of do your own little therapy at home. But of course, I'm always going to say, if you have access to a physician or a physical therapist, you want to talk to them first, okay, if you have access to it. But let's say you're in an emergent situation and you don't, and you have to get on this trip, okay? Then I'm going to give you a couple of tips in the next video as far as what you should not do, number 1, and then what you should do, all right? So with this, if your pain is localized to your low back, it's not going down into your leg, all right? You've noticed that, hey, I hurt my low back, but I can get into a position that's comfortable. And if I get into a certain position, it actually reduces my pain, then you might be okay, and you might be able to go on that trip and get away with a couple of things that I'm going to tell you in the next video, all right? Okay, so in the next video, we're going to first talk about the 3 things that you should not do, okay, if you've hurt your low back. 3 things you should not do. And then the following video after that is the 3 things you should do, all right? Between these videos, hopefully you'll be on that trip and well on your way, hopefully somewhere fun. All right, talk to you in the next video.